So the first thing that oftentimes if there's an outbreak, there's a couple of things that have to happen first. One is you have to control the situation. And so in that case, you have to isolate. So they're going to come in and they're going to isolate the animals. They're going to keep them from other animals, maybe even within your own farm. They're obviously going to keep them from animals that are outside. So no shipping animals out, no bringing animals in. So that's the first thing, is isolation. Second is to then start to look at the animals and see, what are we dealing with? Are we dealing with something in the respiratory system, a lung disease? Are we dealing with some diarrhea? Then we're gonna have to collect some samples. And then once we've got an idea of what disease we're dealing with through our clinical signs and through our testing, then it'll lead us to how we want to try to manage it. Some of it can be managed by isolation of the herd and treatment of the herd. Some of it has to do with depopulation. Sometimes you have to remove sick animals from the herd so that way it saves the greater herd. High consequent livestock diseases are going to be diseases that have important factors of them. One, they're very contagious. These are diseases that are fairly easy to transmit from one herd to the next or throughout your herd. The second is that they have significant impact. They can cause high mortality, they can cause high levels of illness, really impact your ability to have an effective and a productive farm. And then also, it's not only a local threat, but could be a national threat. We're all familiar with bird flu and things of that nature. These are diseases that can spread from flock to flock and then cause significant damage to the agricultural economy of the country.
In our herd, we have a designated area for nurturing, and we have a designated area for quarantine. Those areas are areas that we ensure we can use as backup in case we have animals that present a serious disease. If an animal is showing some signs of disease, that animal is separated from the herd and taken to the nursery area. If the animal requires further check, it's taken to the veterinarian. Many of these small facilities depend on efficiency, and the smaller your facility is, the more efficient you need to be, which means keeping those everyday tasks, okay? If you need to take showers to get into your farm because you suspect there is something going on, you better do it. It will be a lot easier for you to discard one animal rather than going out of business because of a biosecurity breach. I know we want to have visitors coming in to see our animals. We are proud of what we do, but we need to make sure that our animals come first. Biosecurity measurements are linked to the data we have. The protocol we follow is to make sure, okay, we need to record as accurate as we can the exact time and date in which the animal died. That's the first thing. Then secondly, we perform a necropsy to ensure and understand the cause of the death. The third aspect is making sure the animal is disposed in the proper manner. We take the carcass to the incinerator. We incinerate all the carcasses to reduce any potential of outbreak.